Dr. Deborah Mayer recently retired from the University of North Carolina Lineberger Comprehensive Cancer Center after an illustrious 45-year career. She has held many prestigious positions, including Director of Cancer Survivorship and Professor of Nursing at UNC, President of the Oncology Nursing Society, and Interim Director of the Office of Cancer Survivorship at the National Cancer Institute. Dr. Mayer was also the only nurse appointed to then Vice President Biden's Cancer Moonshot Blue Ribbon panel. Deb brought years of experience and insight to her work as an advanced practice oncology nurse, as well as her own unique perspective as a cancer survivor. Her body of work in the field of cancer survivorship as a nurse, researcher, teacher, mentor, and advocate will continue to improve the lives of cancer survivors and oncology professionals for years to come.
She has been so talented and accomplished in multiple spheres. There's some rare people that are really on top of cancer policy. And there are other people that are just spectacular clinicians, and other people who are educators, and some who are researchers, others who are really good writers or editors. Deb is able to kind of operate beautifully in each of those spheres. Deb's influence in the survivorship world, kind of nationally, internationally, is undeniable. But I can also tell you that she has been incredibly effective at the local level at the University of North Carolina. So in her time as the Director of Cancer Survivorship here, she was able to organize and put on really extraordinary annual programs for survivorship for patients and family members. She was able to adapt, modify in really important ways the Cancer Transitions program that she ran here. She had a survivorship clinic in the breast group that was, I think, really very effective and complementary to the primary medical oncology care that went on. And what I really loved about her influence in the survivorship world at University of North Carolina is that she engaged primary oncologists to think very differently about survivorship care than they had before she was here.
Deb's role as a teacher and a mentor has shaped many careers. She has trained more than 75 nurse practitioners and guided the careers of countless others, always encouraging her students to challenge themselves and pass the torch by mentoring others.
She has the passion. She's worked clinically for 40 plus years. And so I think as she's educating us and mentoring us, she's also thinking about her clinical practice and the situation that she might have had with some of the patients she's cared for. And so that's what makes it very special to me, is that she's just not talking the talk, but she's walking the walk with a clinical practice and really bringing in, this is what I'm seeing in clinical, and this is what may be in the book, but let's think about how do we marry both of them and say, this is what current evidence supports. So I think that's just who she is. I mean, she's a mentor at heart and a lifelong learner. She's really humbled herself to say, how can I ensure that the current and next generation have what they need to be successful? But more importantly, how can I ensure that they have the resources and support to ensure that we are really taking really good care of individuals with cancer and their caregivers?
Jean Mosley and Deb have known each other for more than 40 years, both oncology nurses who met through their involvement in the Oncology Nursing Society. The two stayed connected over the years as both professional colleagues and personal friends. After a career of caring for cancer patients, last year Jean became a cancer patient herself when she was diagnosed with angiosarcoma.
I was well aware of the severity of this diagnosis and the challenge of the treatments ahead for me. As soon as I walked out of that office, my first phone call was to Dr. Mayer to let her know about the clinical diagnosis. And she became my personal advocate and my very extraordinary friend. I am very grateful to have had her walk this road with me over the last 18 months. You can recognize the professional value of a colleague or a friend by the papers they write, by the awards they win, by the publicity that they receive based on their outstanding academic work. But I was really struck by the tenacity of Deb Mayer as my patient advocate and the person walking right beside me, step by step. Because of the pandemic and because of the frequent need to receive cancer care, it was not possible for Deb to be here with me for those sessions, but she was always available and has attended every single one of my appointments with me by FaceTime, with the exception of radiation therapy. She was my own personal PhD oncology nurse who specializes in survivorship. So what could be better? I was just very blessed to have her with me and look forward to her continuing to support me as we continue down this road.